Another question is, what's going to happen if I don't do the root canal? If you don't do the root canal, infection is going to get more and more. And then one day, your body is not going to accept the tooth as tooth. So what's going to happen is you're going to have radiating pain and you're going to go to dentist, and then there is nothing we can do. At that point, we have to extract the tooth. And then when we extract the molar, especially back teeth, problem is going to start. So pain is not really indicative of pulp damage or any type of pulp disease. So that's why we really recommend every 6 months you have to see the dentist to actually prevent to having very advanced dental treatment. Normally, root canal is between $750 to $1,500. Depends on who is doing it. If it's general dentist or endodontist is different. But normally between $750 to $1,500. As I mentioned, if you're dealing just with reversible pulpitis, with just the feeling, you can take care of the problem. It's just $250. But if you wait for a long time and you deal with irreversible pulpitis, you have to do the root canal, which is the $1,500 plus the crown over it, which is another $1,000, which is $2,500. And if you have to end up extracting the tooth, what's going to happen is $300 extraction and $5,000 implant. So if you wait for a long time, you're going to deal with advanced dental treatments and more expensive treatments. That's why going to the dentist and do the checkups or follow-ups every 6 months is very, very important. Hey guys, this is Dr. Frank Aryan. Today I want to talk about disease of nerve of the tooth, or what we call in dentistry pulp. When we are talking about disease of pulp, we are talking about 4 diseases. First, pulpitis or inflammation of the pulp. Some occasion, infection of the pulp. So we have 2 types of pulpitis: reversible, irreversible. Third, necrotic tooth or dead tooth. Third, dental abscess, or what we call in dentistry preapical abscess. Also, we just want to know if pain is a right and reliable indication to go to dentist or not, because some people, they think if they have pain, they have to go to dentist. And we want to know if toothache or pain is going to be indicative of severity of pulp disease or not. Let's just explain these one by one. If we want to talk about this disease, we have to know anatomy of the tooth. Let's just see what is the normal anatomy or structure of the tooth. This is the normal structure of the tooth. As you see, we have 3 layers. The outer surface of the tooth is called enamel, which is this white layer. Inner surface of the tooth is called dentin, which is this yellow layer. And innermost layer of the tooth is called nerve or pulp. This part is called pulp chamber, and this part is called root canal. This is another demographic for the tooth structure, or 3 layers of the tooth: enamel, dentin or inner surface, and this is pulp or nerve, which is this part is called pulp chamber and this is called root canal. Usually cavity starts from enamel, and if it is not treated, it's going to go to deeper surfaces. As soon as it gets to the dentin, pain is going to start, because these tubules, actually, they are leading to the nerve. And if this cavity gets closer to the nerve, it's going to cause inflammation of the pulp or nerve, which is called pulpitis. In this stage, with restoration, and there is a procedure, it's called pulp cap, we can actually reverse this pulpitis to the normal nerve. If this cavity progresses to deeper surfaces and involve the nerve, this is gonna turn inflammation of the pulp to the infection. In this stage, we cannot reverse the pulpitis. That's why we call it irreversible pulpitis. If this infection continues to end of the root, it's gonna degenerate the nerve and cause dead tooth. That's what is called necrotic tooth, which is this. The whole nerve is involved. We have necrotic tooth. Sometimes this infection passes through the apex of the root and cause infection around of the apex of the root. This is called periapical abscess or dental abscess. For irreversible pulpitis and necrotic tooth and periapical abscess, most of the time we can do root canal and save the tooth. But depends on severity of the infection, sometimes we have to extract the tooth. As you see in this video, caries starts from enamel, and if it is not treated, it's going to progress to deeper surfaces. When caries get close to the nerve, it's going to cause inflammation of the nerve or reversible pulpitis. When caries get inside of the nerve and involve the nerve, the inflammation is going to turn to infection. This stage is called irreversible pulpitis. When infection involves the whole nerve, it's going to degenerate the whole nerve and is going to cause necrotic pulp. And if infection passes through the end of the root, it's going to cause infection around of the apex of the root, which is called periapical abscess. Now, let's just see how we're going to treat this pulp disease one by one. Be with me. Let's just see how we're going to treat the reversible pulpitis. As we mentioned, in reversible pulpitis, we have a deep cavity, which is really close to the nerve, which is causing inflammation of the nerve. What we have to do is we have to remove all these cavities and we have to put some base and liner material close to the nerve and restore the tooth. The material we put above the nerve as a base or liner is going to irritate the tooth to build up its own tooth structure, and is going to help the nerve to go back to the normal situation. In irreversible pulpitis, necrotic tooth, and periapical abscess, if severity of infection is not too much, we can do the root canal and save the tooth. To be able to do that, we have to remove all the cavities and clean the pulp chamber. If you remember, we actually consider this part of the nerve pulp chamber. We have to clean that actually area and to get access to the canals, which is called access cavity. So after we make that access cavity, we clean, shape, and irrigate the canals, and we put biocompatible inert material by the name of gutta percha, and we seal the canal. And then we build up the tooth. And after a while, if tooth is not symptomatic, we can crown the tooth. One of the questions is, why I need a root canal? You need root canal because cavity is already progressed to your nerve of the tooth and cause inflammation and infection of the nerve or pulp. The nerve of the tooth or pulp is not good anymore, and we have to remove the nerve from your tooth. Another question is, what is the root canal? Root canal is process of removal of the infected and inflamed nerve and replacing it with biocompatible and inert material by the name of gutta percha. Another question is, what's going to happen if I don't do the root canal? If you don't do the root canal, infection is going to get more and more, and then one day your body is not going to accept the tooth as tooth. So what's going to happen is you're going to have radiating pain and you're going to go to dentist, and then there is nothing we can do. At that point, we have to extract the tooth. And then when we extract the molar, especially back teeth, problem is going to start. Another question is, what's going to happen if we cannot save the tooth and infection is too much and then we have to extract the tooth? What is the consequence of extracting the tooth? After extraction of the tooth, especially the lower molars, what's going to happen is top molar is going to drop down and the neighboring teeth, they are going to incline like that. And then you're going to miss the actually space right there. And it's going to affect on your occlusion, a TM joint, and a lot of other problems. So with extraction of one tooth, you're going to lose the space. You're going to have a super eruption, which top tooth is going to drop down. It's going to cause pain. And you have to deal with occlusion problem and eventually TMD or temporomandibular joint disorders. Another question is how long this root canal is going to last. Basically, prognosis for the root canal is very good. Between 85% to 95% we have success rate. But depends on severity of the infection and how you're going to treat the tooth and how hygiene is different. After the root canal, we must crown the tooth because otherwise tooth is going to break. Because after the root canal, tooth is gonna glued or encloses inside of the bone and is very, very fragile. If you actually bite hard on it, you can break it. That's why we must crown the tooth. Another question is, am I going to need another root canal after the root canal I have done? There is a possibility. If root canal fails, we have to do another root canal, which we call it retreatment or re-endo. Root canal fails because of three reasons. Either canal has accessory canals, which is not that common though. Basically, if the canal has an accessory canal, we have to refer the patient to endodontist because they have to do the root canal with a microscope. Or root canal is not really sealed properly. The gutta percha is short, and then we have to remove the gutta percha and then seal the gutta percha all the way down. Or fracture. If it is a fracture, there is no other way around. We have to pull the tooth and extract the tooth because fracture of the tooth, there is no treatment for it. Another question is, how can I prevent having a root canal? Of course, with the 6-month follow-up and periodic exam, you can actually minimize the chance of having root canal because dentist is going to check your mouth thoroughly, radiographically and clinically, and is going to detect if any deep cavity or deep caries, catch into your nerve. Another question is that normal I have a pain after the root canal? A little pain after the root canal, it is normal because we manipulate the canals and sometimes we pass through the apex of the root and that irritates the tissue around of the apex. So pain or little pain after the root canal, it is kind of normal, which your dentist is going to prescribe you amoxicillin or ibuprofen or painkillers or antibiotics to take care of that. Another question is, do I need an antibiotic or any medication after the root canal? This is based on your doctor discretion. I personally actually prescribe my patient actually antibiotic and painkiller after the root canal because any possibility of infection pass through from the apex, we can minimize it. But this depends on or based on your doctor discretion, but there is no necessity in the book. It's not like something we must do that. Sometimes, your body is gonna actually defend that infection because the source of infection is already gone, and we clean the root canal and everything is clean, and your body is gonna actually fight for it and take care of that. But like I said, depends on your dentist discretion. Another question, which is the most important question, which we can summarize the whole video on that, and we can get the education out of it, is this. If pain is going to be indicative of if I need root canal or not. Not necessarily. It depends on process of cavity progress toward nerve is different. If this process is very slow and it takes years actually to get nerve, you're not going to have a pain. You're going to have cavity, it's going to go slowly to the nerve, it's going to kill the nerve, and you're going to deal with necrotic tooth, and you're not going to even have a pain because nerve is already gone, and the process was very slow. But if this process was very fast, as soon as cavity hits the nerve, you're going to have excruciating pain. So sometimes is helpful, but sometimes it's not. So pain is not really indicative of pulp damage or any type of pulp disease. So that's why we really recommend every 6 months you have to see the dentist to actually prevent to having very advanced dental treatment. Another question is, if we do the root canal and root canal fails, and then we do the retreatment or re-endo, that fails too. What is the next step? If we do these two procedures, it fails, but we only have one little kind of like an abscess end of the root. What we have to do is we have to do apicoectomy. As long as tooth is not fractured and we can save the tooth, we can get access to that actually infection. What we do is we do the incision, we open the gum, and then we get the access to that infection and remove the infection from the bone. And then we put some inert material end of the root and we close the incision. This is called apicoectomy. Another question is, how much is the root canal? Normally, root canal is between $750 to $1,500. Depends on who is doing it. If it's general dentist or endodontist, is different. But normally between $750 to $1,500. As I mentioned, if you're dealing just with reversible pulpitis, with just the feeling, you can take care of the problem. It's just $250. But if you wait for a long time and you deal with irreversible pulpitis, you have to do the root canal, which is the $1,500, plus the crown over it, which is another $1,000, which is $2,500. And if you have to end up extracting the tooth, what's going to happen is $300 extraction and $5,000 implant. So if you wait for a long time, you're going to deal with advanced dental treatments and more expensive treatments. That's why going to the dentist and do the checkups or follow-ups every 6 months is very, very important. Thank you for watching this video. Please like and share this video. I hope this actually video was very useful for you. Please like and share this video and subscribe my channel and motivate us to make better and more useful videos. Thank you and see you.